Hello, my name is Bo Rambaldini. I'm a Bundjalung man from the far north coast of New South Wales, and I'm also the director of the Poche Centre for Indigenous Health at the University of Sydney. First of all, I'd like to acknowledge that I'm coming to you from the traditional and sacred lands of the Gadigal people of the Eora Nation. And I want to pay my respects to elders past and present, and thank our ancestors for guiding me to try and improve the health and the quality of life for Aboriginal people in this state. You know that a lot of strategies and plans have been written about Aboriginal people, and this has been happening without any engagement with Aboriginal people, because a lot of people that have never walked in Aboriginal people's shoes seem to have a lot of say about their destination and what's best for them. And it didn't take us long at all to understand that we need to listen and hear what Aboriginal and Torres Strait Islander people have to say, because we find that local Aboriginal people not only know the issues that impact on their life and why they're not getting well, but they've also got a number of options how to go about fixing those concerns that they've got, particularly around health and particularly around oral health. And they've given us a lot of reasons to work within those communities and to work within strong and positive partnerships with them. Look, our approach is built on mutual respect, trusting and effective partnership between the Poche Centre for Indigenous Health and Aboriginal communities, Aboriginal community-controlled health services, and also local health districts, and the private sector as well. So addressing this in a way in this holistic health needs of Aboriginal people now and into the future is important, and we also need to nurture those relationships so that we can keep them strong and that we deliver in these partnerships the outcome that Aboriginal people would like to see implemented, and to help them with their health outcomes, and also to assist them take their rightful place in society. And I think that these partnerships are so important. They're the solutions to try and address all those aspects that impact on our lives, about closing the gap and to improve these issues regarding around oral health. We all know that we are the only race of people that are entered into the closing the gap through the National Cabinet. And we're in there because we have the worst health outcomes than any other group in this country. And all the reports since the introduction into closing the gap into the National Cabinet, as all the Prime Ministers that have given a report to Parliament has indicated that gap's not closing. And the only way that gap will close is to have an effective and powerful partnership with Aboriginal communities. Without bringing them along on this journey with us as equal partners, we will not be able to address the real issues that impact on Aboriginal people at the local level. Oral diseases are more prevalent in Aboriginal Australians than that of non-Aboriginal Australians, and contributes to serious ill health and lower life expectancy. It is widely documented that tooth loss can severely impact on a person's well-being and overall systematic health. So it's important that we address oral health through providing assistance through dentures. And to do this, partnerships is one of the most important things you can do. Community engagement provides an opportunity to instill contemporary and cultural respect, approaches to help promotion, models of service delivery, prevention and early intervention management, and also informs research conducted by the Poche Centre that we do here in New South Wales. So the Poche Centre for Indigenous Health works in partnerships with communities and Aboriginal community controlled services and local organisations, local, state and federal governments to develop unique responses to meet these needs within the community, so we can again further work to improving the quality of health and closing the gap within Aboriginal communities. Each year, a statewide expression of interest is distributed to all New South Wales Aboriginal community controlled health services with a fixed chair dental clinic eligibility criteria applies, which includes demonstrated need, patients deemed dentally fit, all required dental treatments has been completed prior to the clinic, be able to provide a dental clinic for taking impressions and issue of the dentures. Supporting the clinicians as required. There is no financial burden to Aboriginal community controlled health services to take part, and the Aboriginal Health and Medical Research Council supports the program. New South Wales has an average waiting period for dentures in New South Wales public health is several years. Many regional and remote area patients must travel hundreds of kilometres, placing a great financial burden on them to reach dental clinics. And the Poche Centre Dental Clinic travels to these locations in regional remote areas and thereby has the weight of extensive travel and expenses for the patient removed.
I grew up not being taught how to brush, and then now that they got all these programs running in the schools on toothbrushing, and it's just, yeah, it's great.
Paul Talbot, I'm very pleased to invite you to come and receive your award.
Boggabilla born and bred, Paul Talbot is playing his part in this dental revolution. He's just graduated as a dental technician. Now Paul Talbot helps to drive an innovation improving dental care in regional areas. Dentures for people in far northern New South Wales were once made by technicians thousands of kilometres away. But this purpose-built van has changed all that, and Paul Talbot can make a dozen new sets of teeth in days.
It is incredible, like 4 days. Usually it takes like 6-7 weeks from start to finish. And you fly in on Monday, then you have the dentures finished by Thursday.
The Poche Centre Dental Clinic is able to do the impressions and have Aboriginal people with brand new dentures within 4 days. And that's a remarkable achievement since in the public health system it takes several months for them to and several visits to have this completed. So to have these things completed with our valuable partnerships with our clinicians and volunteers it has been a great success to the model that we implement here in New South Wales.